Hello, hello. We hope everyone is doing well in probably home offices as you manage the great quarantine of 2020. When we we organized this, we didn't know we'd all be at home, but we're still going to have a great webinar for all of you today. So my name is George McLaughlin. I work at Redox and I lead up a lot of our marketing efforts. One of the things that I get to do that I enjoy the most is to tell stories of our partners. The way we always think about it is that our partners are the ones that are creating solutions that are improving the lives of patients and providers, and we fulfill a critical infrastructure piece that allow them to have a bigger impact and to reach more lives as quickly as possible. So this webinar today, I'm really excited to go over how we partner with Roundtrip to make sure that they can integrate with all of their customers in a really efficient way to be able to get their product in the hands of caregivers and then obviously to benefit patients over time. So I will be sort of walking us through the flow of content. I have Ankit Mathur from Roundtrip here, the CTO. Get a good wave. And then we have Brendan Eigelhart from the Redox team. He's an implementation manager. So he's one of the guys on the front lines who are actually standing up these projects with Roundtrip's healthcare organization customers and making sure that everything gets up and running smoothly. So a little bit of logistics quick. So there is a question button at the bottom. We probably have about 20-25 minutes worth of content, and then we will leave time to answer questions. So if there's anything you would like us to touch on, please use that button. It makes it easier to make sure we get to them at the end. And otherwise, we have a poll set up. Please feel free to answer as you like, and feel free to chat as we go through. So without further ado, let's kick off to learn about Redox and Roundtrip and how we partner to provide a fully integrated patient transportation experience. All right. So I'm going to hand it off to Ankit to introduce Roundtrip before we get into things.
Awesome. Well, thanks so much, George, for having us. It's absolutely a pleasure and an honor to be here, even if we are all in our home offices, kind of with Purell by our side. So, to introduce Roundtrip simply, we're the one-stop shop for any kind of healthcare transportation. We really provide an end-to-end comprehensive interface to schedule and monitor non-emergent medical transportations. And we do that by offering a HIPAA-compliant platform to allow any health system to book or schedule non-emergent medical transportation from various different types of settings within their healthcare workflows. We're able to then connect that to a marketplace of hundreds of non-emergent medical transportation companies directly in the area that serves that health system. And while doing all of that and connecting within with EMRs and EHRs, also developing a lot of strategic partnerships to meet care managers, clinicians, discharge nurses, anybody that is responsible for booking and scheduling transportation with the ability to do so without ever having to pick up a phone and providing all of the right data back to the healthcare organization, back to medical transportation companies, and also optimizing resources throughout the entire healthcare workflow. So typically what we really see when we talk to clinicians, care coordinators, VPs and C-suite executives at health systems is that transportation in the healthcare setting is fundamentally broken. While a lot of what we hear is that we have no data on how many transports we're doing. We don't know how many patients are leaving or coming. We don't know why patients are missing appointments. We believe it's a transportation issue, but we don't really know or have any data to support that. We also hear that patients can't get to their appointments because their ride fell through. And that really puts health systems in a very reactive way instead of a proactive approach to saying to that patient, don't worry about getting here. We'll get you here. Just make sure you get the care that you need. A lot of health systems that we talk to talk about patient overflow or bed overflow. A lot of times when you have patients that have been admitted into a facility, maybe through an emergency department or other areas, those patients are waiting hours to get into a bed that could have been freed up if there was an adequate transportation solution in place to provide transportation to be pulled up to that patient right when the discharge was happening. We do hear a lot that there is overordering within that healthcare setting, and then finally we hear that there are thousands of calls that are needed to be made to coordinate that transportation. On average, we've heard care coordinators and social workers spend over probably close to half of their day booking and scheduling and coordinating non-emergent medical transportation through our platform. You can do that without ever having to pick up a phone. So we believe that the time is now to essentially remove transportation as a barrier to care, and Roundtrip is really at the forefront of that. We see that on the outpatient side, the national no-show rate for medical transportation, the national no-show rate for patients at healthcare facilities is hovering around 18 to 20%. We've actually seen it as high as 40% in some of the healthcare facilities we work with. We're able to reduce that down to 4%, which is leading the industry in no-show rates. We are able to increase throughput when it comes to in the inpatient settings. Again, the value of creating a very efficient bed overflow management. And then also minimizing all of the operational burden as it relates to coordinating non-emergent medical transportation. And this, is not just in the outpatient and inpatient setting, but this falls into all aspects of healthcare, and even into well-being as well. So what we've done is created a comprehensive solution. We've got a national partnership with Lyft, where we're able to serve all types of patients, and that includes all vehicles, all payers, all in one place, all through one platform, and that's through Roundtrip. So for those patients that are able to walk and get curbside without any assistance, we're able to introduce rideshare into those healthcare facilities, and within 3 minutes usually being able to get a car directly in front of that individual or that patient to get them to where they need to be. But for those patients that need higher levels of service, whether it comes to maybe a hand-to-hand or door-to-door or even door-through-door, we offer the higher levels of transports, and that's where we partner with medical transportation companies all over the country that are able to accept rides without ever having to pick up a phone or answer a call. And not only do we service all vehicle types, we work with the insurance industry that's already in place, Medicaid, Medicare, private insurance. We want to make sure that if health insurance covers the cost of that ride, that neither the patient nor the facility is responsible for that ride. We offer full pre-authorizations for all of those rides to make sure that that burden falls on Roundtrip and not on the clinician that really could be caring for that patient instead of navigating through a complex insurance workflow. So one of the questions that we really get with our healthcare partnerships is, why integrate? What's the reason for that? So one of our biggest reasons for it is simply user experience. We see that when you don't integrate with an EMR or an electronic medical record system, that there's a lot of copying and pasting, a lot of transcribing from an EMR over to Roundtrip, and we believe that through an integration that eliminates all of that double documentation or even the ability to maybe mistype something that could be vital for that patient to be transported properly. We want to make sure that we also can get up and running quickly. So we really do believe that by integrating within a health system's electronic medical record systems, we're able to really start the implementation process much faster and frankly meet the health systems and clinicians right within the EMR. And we believe that that's a fundamental part of where we sit in the entire healthcare workflow, which is anytime a patient has a touch point within the health system, transportation is available and able to be served up via Roundtrip.
Awesome. So this is where I hop in. So this is where we happen to talk about Redox. So Roundtrip made the strategic decision to partner with us to power their integrations. And they very often get the question of, why, or who are these people, and what does an integration look like, and all of that. So let's go through what Redox is, and then we'll go into more detail with Brendan and Ankit what an actual Roundtrip integration powered by Redox looks like and what it means for a healthcare organization. So Redox exists really because, as we've seen, there has been an explosion of digital health tools in healthcare, pretty much from the time that EHRs became prevalent in 2008 to today. I think Julie Yu at Andreessen Horowitz put it really pretty well, that there was this first stage of digital health transformation in healthcare, which was the installation of electronic health records and moving from paper records to this digital format. And now those have become the systems of record. And now we're in this stage of a influx of specialty solutions that can augment and extend that primary source of care that healthcare organizations are using to solve so many different problems. This one, obviously, today is patient transportation. And the role that we saw was that Roundtrip is going to be able to solve that problem by being laser focused on it and providing a solution that really meets the needs of care coordinators and patients and can collaborate with all the different transportation organizations and what have you, much better than an EHR that's going to add a module for patient transportation in addition to all the other functionality they have. And what we saw as we were seeing these specialty solutions develop was the fact that there's a common thread. Whenever a healthcare organization adopts strategic technology, it needs to be able to speak with and work alongside whatever systems are already in place. And what we were seeing was that every single digital health vendor was being tasked with becoming an integration vendor and learning how to connect with all of these different systems and accommodate all of these different workflows. And it was distracting from that laser focus on a specific patient and provider need, which is really the most value that they can provide in the market. So what Redox exists to do is to be the single organization that needs to handle integration, so that healthcare organizations can focus on delivering care, and that these specialty vendors like Roundtrip can focus on solving a specific problem at a best in breed level, instead of being tasked with all these additional technical implementation, healthcare specific knowledge tasks. So the way we position that is we have a centralized platform and then a team of experts that support our partners and allow them to scale and integrate efficiently with all of their healthcare organization partners. So if you think about this, if you think about it from a health systems point of view, as organizations like Roundtrip exist and they choose to adopt this solution, without a solution like Redox, you enter this world where both Roundtrip, as they're scaling to their customers, has all these independent integrations that they have to establish and maintain, and slows the adoption of the tool, and then takes technical resources away from their team, which could be focused on functionality development. And then at a health system level, you have this tangled web of additional point-to-point integrations to your EHR, your patient transportation platform, your chronic disease management platform, your revenue cycle management platform, your population health analytics platform. And we believe that we can centralize this and make it better for everyone. So to summarize, what Redox offers is we provide organizations like Roundtrip a single data standard to work with. It allows them to develop against a single API and use that to execute the data workflows that they have across all of their partners. This means that they don't have to do a bunch of extra development every time they bring on a new customer, which allows them to go live quickly and allows them to scale efficiently. The Redox platform, it's also our job is to be the data stewards between trusted entities, right? So security is paramount to us, and we are continuing to push the envelope and push the industry forward on what that means. So today that means high trust certification, SOC 2 certification, and in addition to a lot of security programs like the public bug bounty program and other things that we're doing to try to keep pushing the envelope to ensure that patient data is secure at all times. We also offer we're one part technical platform. So Redox is a proprietary platform which handles healthcare data exchange in a unique way. But we also have support services that work with our partners at every stage, and also maintain connections for the life of that, which provides a lot of support to both the healthcare organization and to organizations like Roundtrip. So to summarize what this allows Roundtrip to do by partnering with Redox, by not going it alone, not bringing integration totally in-house, it allows them to confidently say that Roundtrip can readily integrate with any of the 40 plus major EHRs, which are used at healthcare organizations. It allows Roundtrip to support true bi-directional workflows using whatever healthcare data standard or exchange protocol is available, depending on your EHR. If you're an Epic system, if you're a Cerner system, your next gen system, if you're a Practice Fusion system, et cetera, Redox is connected with all of those, and we abstract away from those differences and allow Roundtrip to execute their workflow. And then finally, what I think Redox really specializes in is executing really deep, meaningful workflows. Thankfully, healthcare data exchange is getting a little bit better than it was when we first started. But in some situations, that results in read-only form like workflows or specific elements of information. Redox really specializes in bi-directional and deep integration with partners. So Redox today, we call ourselves a network because all organizations that exchange data using Redox do so across a centralized platform, which allows us to, again, we're basically building infrastructure for data exchange for the entire industry and then licensing that out to each side of the network. So today we work with over 250 different vendors like Roundtrip, big names like you've heard of, like Microsoft and Stryker, in addition to Roundtrip, and then also all across the spectrum of care coordination, patient engagement, so on and so forth. And then on the other side of organizations that have used Redox to integrate one of these solutions like Roundtrip, we have over 700 plus provider organizations. This means, everything from large integrated delivery networks down to specialty clinics and so on and so forth. So at the end of the day, Redox allows organizations to exchange data with a bunch of partners using a single connection, a single format, and stay focused on what they do best, and we can stay focused on integration. So that's the Redox overview. We're happy to explain more. Check out redoxengine.com if you want more details. But let's get into the Redox Roundtrip partnership and have Brendan and Ankit dive into that in more detail. So I want to start with Brendan. When we look at an integration project powered by Redox, you're an integration manager. You work with healthcare organizations and the Roundtrip team every day when you're doing these. Can you talk through what does an install look like, kind of cover who needs to be involved, what's required from an HCO?
Sure. So typically the first phase of the process is having an integration kickoff meeting. And so that would typically be my or the assigned integration manager's first engagement with the project. And that's an opportunity for us to bring together the assigned integration manager from Redox, as well as the folks from the health system and then the install folks from Roundtrip all together in one place to kind of set the stage for what the integration project is going to look like. So in some cases that will take place concurrently or before or after kind of an operational kickoff for the larger install from Roundtrip. We are flexible with that and kind of just fit in whenever that's appropriate on the projects. But during this integration kickoff, there's a few different roles that we would typically see represented there. So usually at the health system, they'll have some sort of project champion or IT lead on the call who will serve as kind of a point of escalation throughout the projects. Also might provide some project management input as well as the project proceeds for both, again, the integration parts of the project as well as the project as a whole with Roundtrip. Typically, we'll also have a network analyst involved. So this is a person that would assist with VPN connectivity or whatever connectivity is involved with the projects. And that's generally a fairly short engagement. So we try to get that done within the first week or two of the projects, just depending on how long that takes from the health system. And the nice thing with that as well, as we kind of touched on this, is if it's a health system that has worked with Redox previously, typically that person's engagement is going to be very limited because we're able to reuse VPN and connectivity across different applications that might be connected with the health system already through Redox. Again, in addition to that, we would have an IT lead as well. So this person would be kind of the primary contact just for general IT department project management issues. And then an interface and EHR analysts. So the interface analyst would be the one who would be kind of working with us on any tweaks or changes necessary for the interface, including like HL7 message formatting and things like that. And then the HR analyst would be someone who would work within the HR, whether that be Epic or Cerner or any of the others, to do any tweaks necessary to accommodate the integration projects. So those are the key players from the health system side. Like I mentioned, from the Redox side, it would just typically be me or another integration manager. And then we would pull in our networking teams and engineering teams and others from the Redox side as necessary throughout the projects. But the IM or integration manager is the primary point of contact from Redox throughout the projects. And then there's a couple folks involved from the Roundtrip side. Ankit, I don't know if you want to touch on that.
Yeah, so on our end, I think one thing that's really great is that, we can really let Redox do a lot of the heavy lifting while, we really focus on implementation from our client perspective and from the healthcare system perspective. So typically for us, who's involved is our integration product manager, who really works really closely with Brendan and his team to make sure that everything is being configured properly, that data is flowing, being mapped properly into our system as well. And it's really just facilitating the QA as well. So between a product manager and a QA resource, we're able to kick off the integration without any hiccups.
Awesome. And then obviously, so in integrations, we always like to talk more about basically tasks that need to be accomplished and maybe resources required. But can either of you give a general ballpark of a realistic time frame for this to get completed? Again, we know when you have, it's more when a resource is assigned than the actual, it's not a linear, all these things have to get done hour. But for the past of the Redox and Roundtrip integrations, what's a realistic timeline that you've seen?
So I can start on our end. We typically, with all parties engaged, see an integration occur within 6 weeks, sometimes a little bit longer. But for the most part, it is a really simple process for all parties involved, Roundtrip, Redox, and also for the healthcare organizations. Setting up that VPN can usually happen very quickly. And then, with Redox being able to, not have to conform to specific message specifications, I think that relieves a lot of resources from the healthcare side and the health system side. And with our mappings already in place in relationship with Redox, it's a really easy switch for us to turn on and start accepting messages.
And Brendan, can you dive a little bit into the message specs and how that works, how we can save time there?
Sure. So one of the benefits of integrating with Redox is that we, as we've kind of touched on, we have integrated with pretty much every certified EHR out there. And we have a library of over 2,000 pre-built configurations that map the data that comes in from the EHR into the Redox data models. And so that allows us to say if we have for example, a Cerner site that kicks off with an integration with Roundtrip, we can pull from those existing configurations, and those are based upon the kind of pre-release message structure that we typically see from Cerner. And sometimes there's a few tweaks that are necessary to make to those based upon a health system and how they've set up their HL7 or other integrations. But we have a huge library that we can draw from, and a lot of times those are plug and play or just require a few small tweaks that take just a couple hours of time from the Redox perspective. So as Ankit mentioned, once we get connectivity up and running, and they're able to get some sample messages flowing from the health system, in a lot of cases, that's nearly plug and play to have those messages come across and then converted into Redox data models and sent over to Roundtrip. So that can be as short as just a few hours of testing and configuration there. So it's a pretty speedy process.
And then one other thing I wanted to touch on was, again, like what Redox, what we try to bring to the table is that we specialize in integration. So it allows, again, healthcare organization special in delivering care, Roundtrip to specialize in optimizing patient transportation. Brendan, can you touch a little bit on kind of like your day-to-day and your team, just how, like, kind of give a scope of, concurrent integration projects that you could have going on across our customer base, and then also like a little bit about your background, because I think one of the things that's important about Redox is that you're working with folks who have healthcare backgrounds and do this type of work every single day. And I think that we find a lot of times our counterparts on the healthcare organization side really appreciate that, because we know we have empathy for them. We know what it's like to build and install an EHR. We know what it's like to be an interface analyst. And we're not just coming in this like, just a random fintech developer coming in and saying like, why can't this just work a certain way? So Brandon, can you just talk a little bit about your team, the type of people that go into it, and how you're growing expertise every single week, which is then shared on future installs?
Sure. So personally, my background is in the Epic world. So I worked at Epic on the implementation team for 4 years, and then spent a few years after that just as a consultant working with various health systems in the Epic world before I joined Redox. And I would say my experience is probably on average, if not on the lower end, of folks in customer delivery at Redox. So the vast majority of folks that serve on the implementation team or in other customer-facing roles have years of experience. Of course, not only with Epic, but with Cerner and Meditech and Athena Health and many other vendors. So like George mentioned, we've been in the trenches, and I kind of was chuckling when you mentioned that we understand it, because we're very intimately familiar with the complexities of EHRs, and not only EHRs, but integration as well, from the healthcare perspective. So we have lots of folks with very deep experience that understand how this works, and certainly are not coming into this blind from the Redox perspective. And in terms of lessons learned, and most of us come from a specific EHR background, but currently right now I have projects underway with Cerner and Epic and Meditech and Athena, probably at least 5 or 6 different EHR vendors involved. And of course, as we get more experience in the area, we share lessons across our teams, and we have a really strong culture of making sure that we aren't making the same, having to do the same research twice as we go throughout these implementations. And so we typically are able to draw from a pretty deep base of experience across all the different EHR vendors.
Awesome. Yeah, I think that's important to call out that, like we said, because we just do integration for this network of healthcare organizations and vendors like Roundtrip, we're able to keep bringing those learnings back. And that's a reason why it's beneficial to partner with us and let us really specialize. So let's move from what a project looks like let's get a little bit more specific. So let's start with Ankit, with you talking through what is a common workflow, which is executed during integration, and then we'll move on to Brendan, kind of translating into EHR or health system IT speak, so that if there's any interface analysts or technical folks on the line, you can understand how we leverage available approved standards across our platform and to power these integrations.
Yeah, sure. So, obviously there's a lot of different ways in which transportation affects a patient, but, in an example of discharging a patient, discharging a patient is not just, simply, one little check mark on in an EMR. There's a lot associated with that, a lot of paperwork that's generated. And so transportation, especially when it's involved in discharging a patient, when that patient doesn't have adequate transportation to leave the facility, can be a really big burden. And that was one of the big areas that we focused on when we were building Roundtrip, working with discharge nurses, sitting with them and understanding their workflow. And so, as you see patients either being discharged back to their home or maybe just being discharged to a SNF or rehab facility, some of the things that we really work on with this integration is, first of all, being able to order that medical transportation directly from the electronic medical record system, whether it's an Epic, a Cerner, and Allscripts. And what that really means is that on that patient's profile or in various other areas of the EMR, having that Roundtrip button there that essentially they can click on, opens up Roundtrip, single sign-ons the user directly into our platform. All of the data is right there on one page for that clinician and discharge nurse to order medical transportation for that patient. Once our platform is open, they have access to the variety of transportation options that we have. Like I mentioned before, we have a national partnership with rideshare, as well as medical sedan, wheelchair van, and ambulance medical transportation companies. All of the information is pre-filled from the EMR, so we're able to reduce the time it takes to book and schedule a ride from typically it takes about 20 to 30 minutes. We find we're able to reduce that down to less than 90 seconds. Once that ride is scheduled into our system, the clinician, whoever has ordered the ride, along with other members of that person's team, are able to monitor that ride in real time, get real-time status updates about the status of that ride for the patient. They know exactly when that patient's transport will arrive. They're able to then navigate the patient to the pickup location or get the patient ready for transportation, and that includes all of the other complications as it relates to physician certification statements and making sure that the patient's family is notified. Roundtrip really streamlines the entire process, and also is able to provide several data points back to the health system, specifically about that patient's trip in real time.
Awesome. So, Brandon, can you take us a little bit under the hood on what a theoretical, under the hood, how you would make that possible for the end user
Sure.
and in the Roundtrip platform?
Sure. So you can see here in the I think the scenario that we were discussing was a discharge scenario. So you can see coming outbound from the health system or the EHR here. Generally, we see that these coming as just standard HL7 messages. So generally ADT, SIU, and perhaps ORU as well, with the patient height and weight information. But what we do when those come out from the EHR is kind of translate them into our data model. So if you look at the common event types that we would see in HL7 messages, those are all mapped to various events in the Redox data model, which through Redox are translated and then sent over to Roundtrip in a standard way. In addition to these HL7 message types here, when we're talking about single sign-on or having kind of a single sign-on based button in the EMR, that would use a SAML message coming outbound from the health system, and then send that over to Roundtrip with the user and patient context, so that then when they're opened up in Roundtrip, they have the correct context ready for them to go and able to book that ride with the information that's been previously sent through those HL7 messages. So just as kind of just to point out that we are, from the health system perspective, we're not at all reinventing the wheel. We kind of adapt to whatever integration method that you would prefer to use, and typically that would be HL7 and then SAML for that SSO integration.
Yeah, I think it's really important for folks to understand that, yes, we do use approved and proven methods, right? There are some integration solutions that will say they'll do some crazy directed database thing, or they'll promise you that the sun and the moon and the stars, and we can do this in this weird way. But coming from, like, we use what healthcare systems are set up to do so that things happen in a secure and stable way. So, and another thing that to call out here at the standardization level is that, so anyone on the call knows that an HL7 V2 spec for ADT, SIU, ORU is going to vary based on the implementation at the healthcare organization. So in a world without Redox, if Roundtrip was going this alone, I'm sure the smart people on their team would be able to, potentially set up, get these interfaces, but then each customer, they're going to be taking in a customer specific HL7 V2 ADT feed and then building a configuration on their side to manage for that specific customer. And you can see how that would extend the time it would take to go live. Whereas with Redox, because we handle that abstraction and normalization, they're always going to have this single Redox patient admin data model, which allows them to not do additional development per customer, and to make sure that their product is also scalable and able to go live very quickly and get this in the hands of the people who need it. So a quick summary again of the benefits. So I think one thing, Ankit, did you want to talk about, we were talking about how basically how you can sort of meet the organization where they are and accommodate with their preferred workflow. I mean, you're not going in there with like, this is it, or like, it's not black and white. Can you talk a little bit about that?
Yeah, absolutely. It's really interesting because healthcare is a very complicated, system. And frankly, clinicians are doing a lot more than just one particular type of workflow every single day. So, it's our job at Roundtrip to meet the clinician where they are. So if it's a discharge nurse, we want to make sure that Roundtrip is accessible right within the patient's discharge workflow. But also, on the scheduling side, if there's as patients are are scheduling appointments, we want to make sure that Roundtrip is available to those schedulers to make sure that they are they're able to access transportation when they determine that transportation is a barrier to care for that individual as well. So we certainly want to make sure that transportation is in so many different facets of a healthcare organization. It's not just getting patients to a medical appointment or even discharges. That those are primary workflows, but when we talk about things such as social determinants of health and maybe getting a patient to a food bank or temporary housing, or even creating programs for whole person care, as we've seen a lot of our healthcare partners do. It's about meeting the clinician and frankly the patient where they are. And it's our job to make sure that Roundtrip is accessible in all facets of the healthcare organization.
Awesome. And then just really quick, Brendan, because obviously an ADT, like an ADT feed can be quite large, and it's important for healthcare organizations to limit what data leaves their system. Can you talk a little bit about the filtering that Redox can apply if that's preferred?
Sure. So I think many organizations, like you mentioned, would prefer to kind of narrow down the fire hose of outbound messages from these various interfaces. But on the flip side of that, I've worked with a lot of small organizations that just don't have the manpower, don't have the desire to do that. And so on the Redox side, we're able to kind of accept whatever you throw at us and then whittle that down to just whatever needs to be accessed by Roundtrip. So we're able to do a lot of that filtering and manipulation on our end if that's preferred by the healthcare organization.
Awesome. So we talked about what does it look like, right? There's this marriage of three organizations. There's the care delivery organization, there's Roundtrip, there's Redox. We touched on that. We touched on kind of what a theoretical workflow looks like. Now I want to just touch on, again, what are the long-term benefits of integrating Roundtrip with Redox and what that means for the organization moving forward. So I think we can just really kind of summarize these here for a time. So when it comes to Redox, Brendan, do you just want to talk a little bit through these specific points about how we support our connections long-term?
Sure. So after the integration implementation is complete, we transition support over to our integration engineering team, who are then the point people going forward for any monitoring and support that would be necessary. So as you would expect from an enterprise vendor, we provide 24/7 management and monitoring of all of our integrations, and then have triage support in place for issues that occur at any hour of the day. We also do have custom alerting, so we can notify the integration team at the healthcare system and of course at Roundtrip if any issues do arise. And then we also have the ability to make changes down the road. So let's say that you are going with a different EHR vendor, moving over in that way, or a different billing system, whatever that may be. We have processes in place and the support structure in place to be able to handle that. So that we can ensure that data continues to flow as we want it to over to Roundtrip. We have no interruption in the service that you receive from them.
And then Ankit, do you just want to kind of summarize, again, we went into this at the beginning, why does Roundtrip integrate? Like, what's the point? You did a good job of covering that, of calling that out in the beginning, but at the end here, just again, the fact that an organization now has a fully integrated version of Roundtrip, can you just touch on the impact to end users, patients, and whatnot?
Yeah, absolutely. I think that care coordinators, we call them care coordinators. They could be care managers, social workers, discharge nurses, nurse practitioners, anybody that's really responsible for booking or scheduling or ordering medical transportation for patients. We want to make sure that they're operating at the top of their license. So we want to make sure that these clinicians are able to focus on taking care of the patient, which is what they signed up for, instead of making all of these calls to the patient, to transportation companies, trying to coordinate, which transportation company is going to be able to pick up my patient first, which one's the best fit, navigating through complex insurance workflows. So, we just want to make sure that, clinicians are able to do what they do best, and that's taking care of patients. Let us focus on all of the other nuances around, actually getting that medical transportation done and on time. We obviously want to continue to improve patient flow. So not just bed flow management, making sure that patients are showing up to their medical appointments as well, and just overall general smooth operations as it relates to the healthcare system. And also being able to provide all of that data right back to the health system, so they know, which medical transportation companies are on time, which ones may be delayed, which medical transportation companies are offering the best quality and service based on quality ratings that we capture. So we capture so many different data points. We're now able to provide that information back to our healthcare partners so they understand their ecosystem of medical transportation and the network there, and even potential gaps in either ambulance or wheelchair or medical sedan services that support that health system.
Awesome. So we will get to questions in a second. I will just put it out there. Brendan or Ankit, is there any last thing you want to touch on that we didn't cover so far?
No, I don't think
awesome.
So. Yeah.
So just a mention here of how to get in contact. So if you'd like to learn more about Roundtrip, please just email directly at hello@roundtriphealth.com. We've also listed a resource here. They have an EHR integration guide, in addition to a lot of really great resources on their website. So check out that link. At the bottom, there's a call to action button here that will also link you directly to that. And then at Redox, again, Redox is Roundtrip's partner. So Roundtrip brings us into their projects. It's when they're about to get integrated with the health system, we come in and do our part. We're the integration experts that walk everything through everyone through what needs to happen, and do so in an efficient way so that Roundtrip can get up and live in an optimized way as quickly as possible. So thank you everybody for attending. And I think we do have a question or two in here. So if you haven't asked it yet, feel free to hit that button at the bottom, and I will kick us off here. So the first one we have is from Scott M. So it's, what kind of volume are you handling? You mentioned 700 providers. Are you handling hundreds or thousands of transactions per provider daily? So Brendan, do you, and we always go back in the Ask the Data Slack channel of the current throughput. I know it's in the millions a day. Do you know the exact number?
Yeah, I mean, from the Redox perspective, it's many millions per day. But if we're looking at from the perspective of perhaps one healthcare organization connecting to Roundtrip through Redox, certainly in the thousands of 10,000s of transactions per day would not be unusual. I know personally the organizations that I've worked with integrating with Roundtrip are fairly large organizations, and so I would have to pull the exact numbers, but it's definitely in the many thousands per day of transactions we're coming across. And from the Redox perspective, we're very scalable and work with some of the largest organizations in the country, so we can handle whatever comes at us.
Awesome. Yeah, and that's an important thing to call out. I mean, the main challenges that Redox is handling is because we're powering this type of integration workflows across this entire network, in addition to Roundtrip, right, or other customers, we have to continually solve the ability to handle those throughput problems at orders of magnitude over that, right? At all times, we always have to stay ahead of our entire network, which again is a benefit that goes down to Roundtrip and their partners. We've had to solve, how do we process millions of messages a day, billions a year, whereas a single organization would be tackling those engineering problems as they got there, or right as they got close to there. But we've already solved that for Roundtrip to ensure that this real-time bidirectional flow is able to continue going no matter how many customers they have. So then we also have a question in the chat from Shannon about, do you handle exclusively the integration, or do you also do some kind of EMR cleansing normalization? So Brendan, I'll start and then you can add on top of that. So I wouldn't say we do cleansing, but when it comes to normalization, the way that I think of normalization is that, again, in allowing Roundtrip to have a build once, go anywhere solution for their product, that means normalizing value pairs. So for instance, male, is it going to be M, male, 1, whatever you would have, we would normalize that down to, in the Redox data model, it's outlined to a specific value, and that would be the same across all their partners. So there's definitely that type of normalization. Brendan, is there anything else you want to add specifically to that question? I don't know if I'm missing something about what exclusively integration means.
Yeah, I mean, that's the first thing that comes to mind, but then also just to kind of touch on again that the value of our configuration libraries, that we can handle kind of funky situations if you're sending us information in non-standard fields within the HL7. We're able to adapt to that fairly easily. And so rather than having to put the onus on the health system interface team to make a bunch of interface changes, we can usually just take whatever you throw at us and make sure that it's plugged in correctly into our data model before it's sent over to Roundtrip.
Yeah, and on the Roundtrip side, we always treat the EHR as the as the record of truth. So we don't overwrite any of that data, and Redox has done a really great job of just providing us with the data points that we need, and always updates that in real time. So it's great.
And then I do want to call out, just in case. So obviously we gave one example and we used an HL7 v2 example, but I do want to call out also that the Redox platform is compatible with web services. It's compatible with Fire. It really is, again, it's whatever the EHR is able to communicate information, and we can make use of that. So again, we can use an API program from Allscripts. We can use Fire as it's starting to get implemented in other places. I just want to call out again that it's not a strict HL7 v2 integration. It's really what is available, and frankly, that's still the most commonly available thing, but that's obviously changing. And Redox is set up to grow with the industry and allow Roundtrip to just continue to connect with the partners with whatever they have. So that's all we have for today. Really appreciate everyone hopping on. A little bit of information. So this link will live on. You could rewatch this. I will sync with the team at Roundtrip and make sure that we email everyone who attended with also a link to the recording and also this resource guide and how to reach out. Please reach out to Roundtrip to learn more. Please reach out to Redox if you'd like to learn more. And that's all I got. Brendan, Ankit, anything else?
Thanks so much. It's been a pleasure.
Thanks, everybody.
All right. Take care, everyone. Good luck in these strange times. Cheers.